Ba lô sơi này cái nhà chỉ cái rộng chỉ một trái này cái nông vẽ này lô sơi này cái nhà là bàn chụp chỉ mới được chụp ba là cả bậc sáp toal ông pi lục về chuyện mình đứt bà William C. Brender ដែលជាវិជ្ជបណ្ឌិតដ៏ល្បីល្បាញប្រចាំសហរដ្ឋអាមេរិកដែលផ្ដល់កិច្ចសម្ភារជាមួយនឹងខ្ញុំបាទនៅក្នុងកម្មវិធី Beauty Guide នេះទាល់តែម្ដងអនុញ្ញាតស្វាគមន៍ជាមួយនឹងលោកដូចតទៅបាទជំរាបសួរបាទ Hello
Hi.
My name is Samon Jam I MC from the Beauty Guide TV Apsara Channel 11 Can you interview for yourself
Sure.
about your work for my people in Cambodia
Hi, I'm William Brender. I'm a board-certified plastic surgeon visiting Cambodia for the 4th time. Not only am I a board-certified plastic surgeon, but I'm a board-certified general surgeon and a board-certified hand surgeon. I've been coming to Cambodia for 4 years now to help reconstruct patients who cannot afford surgery. As I keep on coming here, I see Cambodia improving, and I see people wanting to change the way they look. And I'm very surprised by this visit to Cambodia that people are very interested in cosmetic surgery, particularly of the nose, of the chin, and the breast.
បាទសូមអរគុណបាទដោយសារប្រជាណាចក្រកម្ពុជាសប្តាហ៍ថ្ងៃនេះក៏ជាប្រទេសមួយកំពុងតែវិវត្តទៅមុខឥតឈប់ឈរជាពិសេសគឺពេញនិយមបំផុតសម្រាប់បងប្អូនប្រជាពលរដ្ឋដែលនិយមនៅការកែសម្ផស្សដើម្បីសុខភាពស្រស់ស្អាតហើយជាពិសេសកម្មវិធីខ្ញុំបាទក៏បានការចូលរួមក៏បានការប្រឹក្សាផ្ទាល់ពីវិជ្ជាជំនាញឲ្យកាន់ពេលនេះសូមអនុញ្ញាតផ្ដើមនៅសំណួរដែលជាភាសាខ្មែរសម្រាប់លោកវិជ្ជាផ្ទាល់បាទសូមសួរទៅវិជ្ជានៅក្នុងថ្ងៃនេះថាតើមានមធ្យោបាយអ្វីខ្លះដើម្បីបាទជាការពង្រីកដើមទ្រូងឲ្យមានសម្ព័ន្ធភាពស្រស់ស្អាត
Hi. There are many options for augmenting the size of a breast. The options include, in the United States, a saline implant with a firm silicone gel on the outside, a solid gel or a semi-solid gel implant, and we have a new way of doing it with a bra that puts suction on the breast, and we can inject fat. The history of breast augmentation goes back to the 1950s, where they experimented with putting wax into the breasts. Didn't work at all, it was very, very bad. The first successful breast augmentation was when a French doctor, decided to take a fatty tumor out of the back of a woman and fix a deformity of the breast. And that was adopted in 1950 in Russia, where they would take, I'm not sure whether it's cadaver fat or the person's fat, and put it into their breasts. And it was semi-successful. Unfortunately, the breasts were not very natural, they were firm, they were hard, but in a picture they looked good. The important thing is to make a breast that feels normal and looks normal. We started out when I was a young surgeon 26 years ago. We had gel implants. The gel implants were liquidy and thin. The gel would bleed, and we developed complications of capsule contractures. The government of the United States removed gel implants from the United States, but they continued to be available in France and in Brazil. Now we are able to, after 20 years of research, find that there is no scientific data to prove that silicone causes disease or cancer. And during that time, I was using silicone implants which were filled with saline. What I noticed is that the saline implant was softer and did not develop a capsule contracture like the gel implants. And one of the things that I did in the past was put the implant, instead of under the breast, I would put it under the muscle. When you have someone who is very skinny and they have no fat, if you put the breast implant on top of the muscle, you can see it. It's a little grapefruit sitting on top of someone's chest. That does not look natural. That does not look like a breast. A big ugly breast with a hard round edge does not look like a real breast. A breast has to hang naturally and more on the bottom than on the top. And so I still put breast implants under the muscle. Yes, it's a big operation. Yes, it hurts a little bit more, a lot more. It requires general anesthesia so that you don't feel anything. And now the gel implants are available again. I am putting them under the muscle because I feel that the complication rate under the muscle is less. So therefore, the only two options really available up until recently were saline implants, which were silicone gel on the outside, silicone solid on the outside, or the silicone gel implant where it's solid gel, a solid silicone on the outside and a firm gel on the inside. They have experimented with putting soybean oil and other oils inside of implants, but they developed a smell to them and they were taken off from the implant. They developed polyurethane implants which did not get capsule contractures, but people developed infections from them and they had to be removed from the market. So that the test of time has been the gel implant with a textured surface or a smooth surface. The only implant which I will put in with a smooth surface is a saline implant because the capsule contracture is less. But with gel, I do recommend a textured implant. Again, with regenerative medicine, we have found that there are stem cells in fat. We can make new parts of your body with fat. We can put fat into the folds of your face, which I did 20 years ago, or into your wrinkles instead of fillers. It used to be a big no-no, don't put fat into the breast. Nowadays you can do fat grafting. There is a company that came out with a Brava bra, which was suction cups on the breasts. And they would suck and make the breast bigger. They would make you bigger, maybe 100 cc's, one bra size, and I don't know if it would be permanent. But now with the Brava bra, you can suck on the breast and then put fat in there, and you can get your own breast made out of fat. Unfortunately, a lot of Asian girls are very skinny. They don't have any fat. So this option is not available to them. So the only option is either a saline implant or a gel implant. The difference in incision, saline implant I can put in through a 1-inch incision. The gel implant I have to do a 4-inch incision. So it means more scar.
បាទសូមអរគុណបាទជាការពិតណាស់សម្រាប់ការវិទ្យុបាយវះកាត់ពង្រីកដើមទ្រូងឬក៏វិទ្យុបាយកែសម្ផស្សផ្សេងៗតាមពិតទៅគឺយើងមានការវះកាត់នេះជាយូរយារណាស់មកហើយគឺតាំងពីឆ្នាំ1940ជាងមកម្លេះដូច្នេះសម័យបច្ចុប្បន្ននេះក៏នៅតែជាចំណាប់អារម្មណ៍សម្រាប់បងប្អូនទូរទស្សនិកជនផងដែរនៅក្នុងគណៈពេលនេះខ្ញុំបាទក៏សូមផ្ដើមសំណួរទី3ជាបន្តទៀតដែលសំណួរសូមសួរសម្រាប់លោកវិជ្ជបណ្ឌិតផ្ទាល់តើយល់ឃើញយ៉ាងដូចម្ដេចចំពោះការចាក់ពង្រីកដើមទ្រូងដោយការចាក់ស៊ីលីកុនដែលហាងកែសម្ផស្សមួយចំនួនបានធ្វើឡើងនៅក្នុងប្រជាណាចក្រកម្ពុជាកន្លងមក
As a board-certified plastic surgeon and a member of the American Society of Plastic Surgeons, I am against the injection of silicone into the breast. Not only does the injection of the silicone into the breast create serious problems, but it also creates problems where you cannot see and get any mammogram to see cancer, which is the only treatment we really have, the only diagnostic tool we have for finding breast cancer. I have seen many complications of silicone injections into the breast. They migrate, they move, they cause little bubbles on the skin. You try to drain them, and a few times and more times that I've read about, that the women had to undergo total mastectomy or removal of the breast in order to correct the problem of ulceration and infection from silicone injection in the breasts. In my most recent visit to Cambodia, I've been seeing a number of complications from injections of silicone into the face. I do not know what they're injecting. There's a difference between medical grade silicone and industrial grade silicone. Industrial grade silicone has impurities and is not clean. It gets infected. It creates a hard infected mass on the face and also into the breast. And I've had to do some major surgery to remove these around people's eyes and in their nose. It is very destructive surgery, and because it wraps around the nerves and it wraps around the important structures of the face. So I strongly recommend you do not get silicone injections into your breast or into your face. I also recommend that you ask the credentials of who is injecting you. Are they a real doctor? Are they a board-certified plastic surgeon? There are 3 or 4 board-certified plastic surgeons in Cambodia now. I would seek breast augmentation with these doctors, and don't go to your friend who just happens to have some silicone and wants to inject it in you. I've investigated and looked at the clinic here at the Dermo Clinic. They have a very clean operating room. They have a very safe facility. I think it's a good place to have your surgery if you decide that that is what you want.
បាទសូមអរគុណសម្រាប់ប្រសាសន៍យ៉ាងក្បោះក្បាយដល់លោកវិជ្ជបណ្ឌិតដែលបានជម្រាបជូនដល់បងប្អូនទូរទស្សនិកជនបាទនៅសល់មួយសំណួរចុងក្រោយដែលជាសំណួរពិសេសបាទសូមជម្រាបសួរដល់លោកវិជ្ជបណ្ឌិតចុងក្រោយលោកអាចជម្រាបអំពីចំណាប់អារម្មណ៍ផ្ទាល់របស់លោកវិជ្ជបណ្ឌិតចំពោះបងប្អូនប្រជាពលរដ្ឋខ្មែរមួយចំនួនដែលគាត់មានគម្រោងក្នុងការកែសម្ផស្សផ្សេងៗដែរទេ
My first recommendation is that you need to be very happy with who you are. If you're very happy with yourself, there's no need to change the way you look. However, if you feel uncomfortable about the way you look in clothing, in your bathing suit, or with your husband and boyfriend, and this is something that you really want to fix and work on, there are ways to take care of it. Don't be forced into doing surgery that you don't want to have, because it's an operation and there are complications and there are risks. But if you want to improve the way you look, there are things that you can do. One of the most important things you can do is you need to wear sunblock. You need to cover up during the sun. The sun is wonderful, but as you get older, the sunspots appear on your skin. They make you look spotted like a leopard, and they make you look old. You don't need to do that. If you like smoking cigarettes, I recommend stopping smoking cigarettes. Smoking cigarettes will make you age faster. You need to stop that. Drinking too much alcohol will also make you age faster. So be everything in moderation. In addition, there are skincare treatments that we can do to help you look better and feel better about yourself. You don't have to feel uncomfortable about what you were born with. You don't have to feel uncomfortable about the aging process. There are ways of slowing the aging process down. There are ways of enhancing how you look. Whether it's changing your nose, fixing your eyes, raising the skin, or making the breast bigger or smaller. These things are available in certified facilities, safe, clean facilities with board-certified surgeons. And as I said before, the Dermo Clinic is one of those places that you can come to. Thank you.
Thank you very much លោកលោកស្រីនាងកញ្ញាជាទីគោរពនិងជាទីមេត្រីដែលសារពេលវេលានៅក្នុងវគ្គនេះមានកំណត់សម្រាប់កិច្ចសម្ភាសន៍របស់ខ្ញុំបាទនិងលោកវិជ្ជបណ្ឌិតទៅដល់ទីបញ្ចប់ហើយ Thank you for coming Thank you to come to my show and you explain everything from the people watching. See you next time.
Thank you. My pleasure.
លោកលោកស្រីនាងកញ្ញាជាទីគោរពនិងជាទីមេត្រីលោកលោកស្រីនាងកញ្ញានឹងបានរីករាយបន្តជាមួយនឹងកម្មវិធីវិទ្យាកាយនៅវគ្គក្រោយនឹងជួបជាមួយនឹងខ្ញុំបាទនៅកិច្ចសម្ភាសន៍ជាមួយនឹងលោកស្រីនាងកញ្ញានៅក្នុងវគ្គនេះអនុញ្ញាតសម្រាប់មួយភ្លែតសម្បាទ